All right, good afternoon, South Coast. Hope everyone's doing well out there. We are here for our weekly discussion with some of the professionals at Southcoast Health. So what we're going to talk this week, I have the Urodynamic trio from the Female Incontinence Center. I have Dr. Seva, I have Dr. Michelle Pacheco, and we have physician assistant Bridget Royer. So just going to go through and have each of you kind of just give me your background, what kind of brought you to Southcoast Health. I'll start with Dr. Pacheco.
So I grew up down the street. I grew up in Swansea, lived around here, and trained out in Tufts. Went down to Florida for my residency, and there was no better place to be but come back home to South Coast. Got some offers, but nothing can top this location, as people who live here know. And then when I met my partners that I'd be joining, I just said, "This is home for me. These are the people I want to work with."
Yeah. So how about you, Bridget?
I'm from Rhode Island, so just close by, and I went to college out in California, and then PA school at Northeastern in Boston, and then I have known Dr. Carroll for a long time, and he kind of brought me on board, and it's a wonderful group to work with, and that was the most important thing for me as well. And right into urology with Southcoast.
Yeah, and she's not driving for everyone who's out there. She's actually in the car right now. So we're being safety first here. So how about you, Dr. Seva?
Yeah, so my story is a little opposite. I'm actually from Florida, and then I came to Boston to do my training and met my husband and decided to stay in Massachusetts. And I said I wanted to be near the coast if I was going to have to be in this frigid state. So looked for somewhere around the South Coast and met my great, awesome partners and decided to stay with South Coast.
Yeah. So we'll go to Dr. Pacheco next. So what are the specialties and roles? So like we're talking urology and primarily female, medicine. So you just give me an idea what that is about, and also talk about the you call it the Incontinence Center. I guess you can talk about that as well.
So I cover all of general urology. I take care of both men and women, but obviously we have a very large female population, and they're looking for often female providers, and we're giving them that as well. Some women just feel more comfortable with women. And we offer all sorts of different types of treatment. There are tons of women out there who are suffering from urinary incontinence, and they don't even know that there's something that can be done. They think the only thing they can do is buy stuff over the counter and wear protection pads. When they come to see us, we give them all sorts of different options between medications and procedures and some surgeries, and it gives them hope, and then we make them better and make people feel better about themselves and give them confidence.
I have my mic mute. People might not know, what is incontinence? I don't know what that exactly is.
The inability to control when you're going to urinate or leaking of urine, basically.
Is that something that's common at all? Or is that something that's maybe as you get older, or?
It gets more common as you get older, but we do treat people of all different ages. Sometimes they just have other disabilities or neurogenic problems as well. But it often happens as people get older. And it can be very common. There's some numbers out there that say 1 out of 6 women suffers with some degree of urinary incontinence.
Yeah, it's interesting. So people might not know out there. Where would they go find information if they think they might? If they call your center, and where is it located at?
So the 3 of us all practice out of Fairhaven. So you can just give Southcoast a call, and they'll get you hooked up with an appointment with somebody who can take care of you.
Yeah, so I'll bring in Bridget. So Bridget, if you can just tell me kind of like what's the role like that in Fairhaven, and kind of like do you see a lot of people every day? Is this something that's like a problem in the South Coast, or just with in general with people?
Yeah, so we see with general urology various concerns. I tend to see more females, I would say, than males. Maybe it's, yeah, they're preferring a female provider, but we're open to seeing new patients and really anyone with urinary symptoms that they are struggling with. And I would say since bringing on Dr. Theva starting, I think we've been kind of attracting more patients that would have gone to Boston for certain issues with leakage of urine or involuntary loss of urine, or sometimes when things we call prolapse, or when you have sort of a dropped bladder, we'll see patients for all sorts of reasons and have some really good treatment options available for that.
So is this center new? Is this something that's been around? Because I know Southcoast has been expanding. We have like really expanding over the years. From they have these now, urgent care centers. They have the in Fairhaven. I know they have the cancer facility that opened up about like 10 years ago. Is this something new that is provided by Southcoast, or has it been around for a while?
Well, it's sort of been, I mean, we've had our office here in Fairhaven for maybe 6 years or so, and there we have also an office in Fall River. But I would say we're kind of, it's not necessarily a new location, but now that we're just kind of trying to make people aware that we do welcome patients with those different diagnoses, where before maybe they were going elsewhere to seek care for that. So we're kind of trying to, I guess, promote our specialty, and in a sense, it's almost like more of a subspecialty within urology, but that we're trying to see patients, that we're opening our doors, seeing patients with those diagnoses now too.
Yeah, I'll bring Dr. Seva back in. So what are the different types of incontinence? So it's not just one fits all, right? There's different types of it. Oh, I might have lost you.
Yeah,
oh,
think of it, kind of like a Venn diagram. So there's the incontinence where your pelvic floor is weak, so it's kind of an outlet issue. And then there's the type where your bladder is overactive, kind of loosely putting it. And then you can have a mixed picture of both. So it's really, understanding the patient's story, trying to get a sense of where they're leaking and when they're leaking and how much they're leaking. And then, we have certain ways of doing studies to determine what kind of leakage they're having.
Yeah, so let me go to Dr. Pacheco. So obviously something like this might be something that maybe someone might not want to just reach out to a doctor and talk about. It probably something that someone might be even, I don't know why they would, but it's a mental thing, or excuse me, a physical thing that's going on with your body. Is there some way that they can go and research it more before they actually approach a doctor, or just recommend just calling your doctor right away?
I would honestly recommend just coming in and talking with one of us. Often the first visit that we have is really just a conversation, and that's often where people can get the best information. And there are definitely websites out there that are available for people that would like to kind of look at what's going on with them. But I find that some patients get sort of trapped in websites that aren't giving them the absolute accurate information, or they're self-diagnosing and they're getting the wrong information for whatever is actually going on with them. They may feel like their bladder can't empty, but really they're just peeing too much, So different things like that. But the first visit is usually just a visit where you can feel comfortable speaking with one of us, seeing what your options are. And then if you want to proceed with some of the things we have, we can go ahead and get that scheduled. But if somebody says, hey, thank you for all the information, I'm going to continue doing what I'm doing, then that's fine too.
So who came up with the Urodynamic trio? Is that something Sean came up with, that you guys have?
No idea.
So I guess you three ladies are kind of known to be the experts in the Southcoast. We wanted to bring you on to, and I think Sean might have came up with that at the public affairs for Southcoast Health. But yeah, so the ladies are obviously, everyone can see, very knowledgeable. And if you think you might have incontinence, it's something to go get checked out, because you just don't know what it could be. It could be from bladder cancer or to anything like out there, and it's better to get checked out, early stages. I think that's the kind of general consensus from doctors is, you find something early, it's a lot more chance you can cure it or hopefully mitigate some of the symptoms, right?
Absolutely.
Yeah, so it's important. So you can check out, we'll put the link in there later. We'll put a link to their information. People should go check it out. If you have any health concerns, you can reach out. Very friendly people, as you can see. So I appreciate your time, ladies. Thanks for joining me, and hopefully we'll talk again soon in the future.
Thank you very much.
Thank you.